Hello, everybody. Welcome back. As you know, I'm here with Nikki, who's amazing. I'm not biased. She is my massage therapist, and I send everyone to her. And now she's doing C-section release scar work. So happy days. Welcome.
Thank you. Hi. Yeah, sorry I can't fit you in, but
Yeah,
you've sent too many people to me, so now I can't fit you into my schedule.
no, I
Sorry
know.
about that.
Well, we're talking about C-sections, cesareans, and I wanted to start off by asking, well, let's explain to the listeners exactly what a cesarean is so that
Yep.
listeners can really appreciate what women
Yep.
go through.
So when you have a cesarean section, your doctor, your obstetrician, is going to cut through 7 layers. So a lot of the time, when I talk to or ask a woman, do you know what a cesarean section is? Do you know what happened when you had your surgery? Most women just think that there's just one big cut, and generally, yeah, it's a horizontal cut and it's just one cut and then they're opened and there's the baby. But actually what they are doing is cutting through 7 different layers, and you will find that they do actually cut through those quite separately. It's not just one big slice and you're open. So we have the skin. So the skin's obviously the outermost layer. So when you have a cesarean section, most women that I talk about it tend to think that they just get one single cut and then their belly's opened and the baby's just there. So normally a horizontal cut, but actually your surgeon, your obstetrician will go through 7 layers. So we have the skin, which is the outermost layer, so the top layer that you see, you feel, you touch every day. We then have the subcutaneous fat, so located directly underneath the skin. And when that's open, it sort of looks a little bit bubbly and yellowy. And if you go to look at a photo or you look at any videos, you can really see that it sort of opens out a bit like foam. So cut through the fat, we then have the fascia. So the really, thin connective tissue that covers the abdominal muscles. So fascia's, a whole nother podcast. We could talk about fascia and how the fascia itself can affect your cesarean scar, but we'll leave that one. So we have the fascia, we then have the muscle. So you've got your rectus abdominis, and normally this is actually not cut. So most of the time your surgeon will actually pull apart the muscle, which is vertical. Yeah. So rather than it being cut, it's actually pulled apart. And most of the time, the reason they do this is better healing. It will sort of regenerate itself better than if it's cut. So yeah, the thought of that in itself, I think,
Yeah, I'm
feels
just
like,
squirming in my stomach
yeah,
a little bit.
yes, yeah, yeah. So muscles pulled apart. Then we have the peritoneum, which is like like the membrane, it lines the inside of the stomach and the pelvis. So it's a little bit like fascia. It's sort of thin and sort of sticky. Then you've got the uterus. So your baby's obviously sitting inside the uterus, and that's typically a little horizontal cut as well. And then you have the amniotic sac. So for some women, that sac has already opened. Obviously, if your waters have broken, then the baby's already just sitting in the uterus, whereas for other women, that sac is still in place, and they may just use their hands to open that, or they might just nick the amniotic sac for that to open. And again, we know that is not very thick. It's just a tiny little nick and it opens. So 7 different layers, 7 different ways of getting into that baby. And I think if you really think about that in the healing process, that's a lot that your body has to do itself to be able to pull it all back together over months, years following your surgery.
It's crazy what a woman's body goes through during that. And it's a big operation, it's a big deal.
Absolutely.
And it just seems like, again, mums are totally neglected postpartum, as if like not giving you the information that it is a big deal. This is like, it's not an easy thing to have gone through.
Not at all. And I guess I am always looking at, when I'm explaining this to women that I see, And I will always explain this to them every single time that I see them, whether it's in a group environment or I'm individually doing a treatment with someone. I'll make sure that they understand that. I don't have to go to in depth, but I want them to understand that that has happened. And in my personal experience, no one ever told me that. No one ever told me this is actually what's going to happen. The process of you're going to be wheeled in, I'm going to sit you here, you're going to have your spinal, blah, blah, blah. That, yes. But when it comes to how I'm actually going to get your baby out of your tummy, that process isn't. Did I have to ask? Maybe, but I didn't know I had to ask to find that information.
Again, you don't know what you don't know, do you? You don't know.
No. And I also didn't have time to like, oh, hold on, I'll just quickly Google, have a quick YouTube before we go in so that I understand what's going to happen here. And I'm the type of person I want to know. If I could watch the whole thing, I would have watched the whole thing.
Oh my goodness.
That's just me though. I love it.
That's you. Just cringy. So what was your postpartum rehab then? Because you've obviously had the experience of having a C-section.
Yeah. So I've had 2 cesareans. My first cesarean rehab was absolutely nothing. I was so super fit. I did a triathlon 12 weeks postpartum with my first daughter. I went back to teaching aerobics. That was it. That was my rehab. I started Pilates, around 12 weeks. I went to a little mums and bubs Pilates. But to be honest, I really did nothing in particular. I didn't get a pelvic floor check or anything like that. I never really had any problems with my pelvic floor. I did have it checked like pre-baby and everything was fine. But I did absolutely nothing. Yeah.
So what
For the first one.
Yeah. So it was different with the second?
So having the second cesarean and my second cesarean, I really felt like I didn't feel any choice. I felt like I was a bit forced into it. You're not going to leave the hospital today. We are going to have a baby in 45 minutes. The whole process of that was very different to the first. And then I think with my second, I knew I was having a third baby and I knew I was going to have a vaginal birth for my third baby. So my recovery from my second cesarean was everything that I could possibly do. So that's when, all of the pelvic floor stuff started to where do I go? Who do I see? How do I make sure everything's okay? I started to do more pre and postnatal training with women as a personal trainer. I started to see more women in massage that were pregnancy, postnatal, and that drove me to look after myself more because I think I was trying to work out, where do I sit in all of this? Am I okay? Or am I like really bad? But I didn't know. I was just comparing to everybody else. And then I realized I need to go look at my pelvic floor. I need to learn how to activate all of these things again.
I'm glad you mentioned that because I often find when I speak to mums who have had C-sections and I ask them how their pelvic floor's doing, they said, well, I had a C-section.
Yeah. But that's got nothing to do with it, really.
No.
I mean, at the end of the day, just how you birth has not really got anything to do with the pelvic floor. Holding a baby for 9 months, that is where things can start to shift and move, and hormones, it's not just about whether you've pushed a baby out of your vagina or not. It's about
everything else that's gone on before and after.
Yeah, absolutely right. I mean, yes, it is different. Obviously, using your pelvic floor muscles to push a baby through the birth canal is very different than having it lifted up out of, your belly button, basically. But yeah, I mean, it's just education, isn't it? It's just, we don't know where to go. We don't know who to listen to, and we don't know the questions to ask. That's the biggest thing. So if more people are talking about it and more people are having conversations like you and we're talking to our clients, and then they say, I went and I had a conversation today about this with my PT or my massage therapist. Did you know that when we have a cesarean, it's 7 layers? Did you know that? So someone having those, us having them, and then those conversations being shared, that's a start. And then that woman going to their obstetrician or their midwife or whoever their care provider is and saying or asking their question that they have in their mind, just ask it, because then you'll get an answer. If you don't ask, you won't get an answer.
Yeah, it's
Will you
exactly
be
that.
satisfied with the answer? Maybe not. Sometimes some doctors or care providers might sweep that under the carpet a little bit. Then you have to go and ask somebody else.
It's exactly that, isn't it? It's empowering yourself.
Yeah.
Let's talk about so there's two things I want to cover here.
Yeah.
How can the C-section scar tissue impact the core strength and the pelvic floor function? And then I want to go into other areas beyond that incision point.
Yeah.
So
I
the
guess,
core strength and the pelvic floor function.
yeah. So for core, I mean, the biggest thing around how C-section, can affect pelvic floor and core strength. So really, again, you have to think about how the body heals itself. Nothing else heals that Caesarian scar but your own body. And so the way it does that is by, gluing itself back together. And it glues itself back together by forming scar tissue. And so it doesn't matter how long you've had that scar, but obviously over time, that scar tissue is going to start to, like, I guess you could say, sort of spread or get thicker or get stickier. And when these adhesions occur, so I guess you could say an adhesion is a band of scar tissue and it joins two internal body surfaces together that would not normally be connected. And those two surfaces should move freely, but they are then stuck together with the adhesion and the scar tissue. So if you are thinking about, I'm a very visual person, so it's hard to, when I look at a picture, it's like, wow, okay, I really, really get it. But if you, envisage where that scar sits and what organs are there, we got everything. We have our ovaries and our uterus, and we have our bladder, we have our bowel, we have our stomach, small intestine, large intestine. All of that sits where that scar is. So once that scar tissue starts to leak out and attach and attach and attach, and it spreads and spreads, then it starts to bind and it gets tight.
So it leaks out and attaches to possibly internal organs, or?
Yeah. So I guess the scar tissue over time, if it's not treated, if it's not broken up, if we're not trying to break up these adhesions, it will just keep spreading. It'll just keep growing, because that's what your body does. If it's quite healthy, if your body's quite healthy, then it will continue to sort of spread over time. I mean, for some people, maybe not, but for most people, the scar tissue tends to grow. And so
does it depend on the type of person who's cut you, the type of cut, or it just depends on you as your body?
Yeah, I think it's more your body. If you look at someone, I mean, if you look at a scar in itself, like as in an external scar. So if you lined up 10 women that had a cesarean and you looked at what their scars look like, no scar would be the same. Some women have keloid scars, that are really thick and sit on the outside. I mean, I can barely even see my scar at all. I can still feel small adhesions behind the scar when I press and I massage, but externally, nothing on my skin at all. There's no bump, if I just run my fingers. So everyone heals differently, and everyone's scar is going to look differently on the outside. So if it's looking different on the outside, potentially it's healing different on the inside. And that's why I guess, when we work with someone that's coming in for treatment, we're working with them very individually, not just because they had a different birth story than the next person, but because their scarring is different. Some people have no scarring on the right-hand side and heaps of scarring on the left. So
okay, that makes a lot of sense. And so that's how, if the scar keeps growing,
yes,
then how then does that impact the rest of the body.
Well, in every way, doesn't it? Again,
Yeah.
it's so
We
hard
just
to.
think of it as one scar, but there's so much that could be happening for our body, especially if we've left it for such a long period of time because we weren't sure what we can actually do something with our scar.
I guess, I mean, you and we love this shit, right?
We're odd. Yes.
Yes. But for the everyday woman, it's like we're just trying to keep it as simple as possible. And I normally use visual picture. I can use pictures because we can't see the inside of the body. But I like to show somebody this is a picture of what scar tissue looks like. See this organ or this bit of tissue here connected to this bit of tissue here. It shouldn't be. So when you feel pain in your left side of your hip, the fascia is also going to be connected in the right side of your shoulder. But how does that happen? It just does, because everything is connected to everything.
Slings and yeah.
Absolutely. So generally for Caesarian scar, like, yes, all of the planes are sort of involved. But when we're looking at treatment, we tend to be looking more at the frontal fascia chain, I guess, even though everything else can be affected. Most women first complain of obviously pain around the scar area, and then secondly, back pain. And
Yes.
we all know that when you go to the physio, you go to get a massage, that when you're complaining of back pain, we will generally tell you or ask you, so how is your core strength? We look at the core strength first to help relieve the back pain. You go to Pilates and learn to reactivate your core to help your back pain. If you've had something sliced through your abdominal muscles and you have to rebuild the tissue back together, and then rebuild strength, are you going to have back pain? Yes.
What I want to go back to core strength because that's an important
Yeah.
one.
Yes.
But talk to me more about the common areas that you find linked to a C-section scar. You were talking about hip pain. Women may not necessarily link their hip pain to their scar, their right shoulder, their
Yeah.
back pain. What else?
So many things. Most of the time, most women complain mostly of back pain, but the hip pain can tend to be, and mostly the hip pain's more going to come from potential adhesions that are locally there, which are then pulling fascially, pulling on the fascia. But it's not just, I guess it's not just like local, it's not just the shoulder pain or the hip pain. Like, you're looking at pain that might be coming from bowel obstructions, digestive issues, coming from the other, organs that aren't working properly, I guess, or being affected because of the scar tissue. So it's not that it's just, I have a sore shoulder. It's like, it's deeper than that. Yeah, it's sort
And
of,
have
it's like
you,
on and on and on. I guess also it's not just that it's the pain that they feel in the hip or the shoulder, it's the pain that they feel when they twist, when they walk, when you sit down, it's pain on movement, not just a chronic pain that I feel all the time. I don't feel it all the time. I only feel it when I do this or when I do that.
can that actually also be linked to the fact that maybe you feel worried and vulnerable because you've been cut open across your belly? Do you think that people then start changing to protect their body without realizing? And it's not actually technically the scar, but it's more you worrying in your mind to protect your body.
Yeah, absolutely. And then what happens though is, that frontal, we start to, you don't realize it, but you start to, that changes our posture, which we were sort of briefly talking about before. We start to not stand up. We don't stand tall. We just squeeze and suck our bellies in, just suck it in, just to suck it in for no reason. But that
Mm.
changes everything. It changes our posture. It changes the way we, instead of twisting our body, which we should, right? Your thoracic spine should twist. Instead of doing that, We turn our whole body.
Mm-hmm.
We take little shuffle steps to look over our shoulder, shuffle step back to look over the other shoulder, rather than allowing our body to twist and move.
That's another link to the pelvic floor there when you're talking about sucking your belly in, that ab gripping. It was a common pattern for me, and I haven't had a C-section. And I was putting pressure on my pelvic floor because I was scared my organs were going to fall out of my vagina. So I was just tensing up, thinking I was looking after myself when actually I was doing more damage.
Yeah. But I guess it's exactly the same with a cesarean, though. We think our organs are going to come out our guts, so we're just gripping on and holding in for dear life and hope that it doesn't split open. I mean, obviously it's not, but it can feel like the same.
It is a real thing. It's a real trauma. It's a real emotional, psychological connection, which we are going to go into a little bit later on.
Yes.
Because I think it's important to cover. With the core and the strength. Now, I worked with someone, he was a man, so I don't know if this is legit, but he says that if you've had a C-section, if you ice the scar, if someone's struggling to activate their core, test it and then ice the scar and then ask them to activate it again, and then they should be able to activate better. Is that a real thing or is that total rubbish?
I've never tried it. I mean, I don't get it. I don't understand. What's he saying makes it I think
he's trying, the idea is take out the scar. Maybe he's saying the inflammation from the scar.
I mean, the thing is it depends on when that is. Like how long after a cesarean. At the end of the day, inflammation is part of the healing process. So directly after you have a cesarean, let's just say those first sort of week, the first 6 to 7 days, you will have inflammation in your body because that's a natural process. For it to heal, it will get inflamed. The blood starts clotting and it starts to sort of try and clean itself, any debris. It's trying to fight any infection. That's really important for that healing process. So, I mean, that's very early on, though. If you're 6 months, 1 year down the track and there's still a lot of inflammation in that area and that body, then I guess that could potentially be restricting you. Probably personal opinion. There are lots of other ways that you can obviously help your body to decrease inflammation. Just putting ice on something is not necessarily a cure for all. You look at in traditional Chinese medicine, do they stick ice on anything? Hell no. Particularly around that area of the body, your womb, your uterus, that is all warmth. There's no way 1 week after a cesarean in Chinese medicine that they would say stick some ice on your uterus. So that's more of a personal opinion. Lots of other practitioners, really encourage ice therapy, ice baths, that sort of thing. The thought of putting my body into an ice bath a week after having a cesarean sounds like hell on earth.
Yeah.
But I'm not an ice bath person. I'm flat out 55-degree infrared sauna every day of the week. So, I guess that would be, from that man's point of view, his opinion.
Yes. And I think that
just to recap, though, inflammation is good. At the beginning, the healing process, it has to happen for it to get better, for it to heal. And that's why we have to rest. That's why a week after having a cesarean, I mean, even a vaginal birth, let's be honest, you don't need to go to brunch, don't need to catch up with your girlfriends, don't need to go shopping, don't need to do any of that. Just lie down. And if you've had a cesarean, lie down flat. Flatten your body, lengthen, open up. You don't need to do huge stretches, but lying flat, encourage that opening of the, anterior frontal plane of your body.
Let's carry on with this because I like that.
Yep.
I want to talk about what this scar release therapy work is, but firstly, so say a mum's just had a C-section. Obviously, they've not been given any postpartum rehab recovery stuff from the hospital. So you are that person. What should they do? So you say lying flat, rest for how long, and then what?
Yeah, I mean, so when we look at scar, like the actual trick, so us working with somebody, when we're working hands-on with someone, we really want to wait at least 8 weeks. And really we're just waiting 8 weeks for for the scar to actually, I guess you could say, like bind and heal. We don't want any open wounds, we're not working against anything like that. But prior to that 8 weeks and coming in and definitely still going to be a very individual thing. Not everyone their scar is going to be completely healed externally, where those stitches are. At 8 weeks, everyone's going to be a little bit different from there. But those first 8 weeks, everybody will generally see some type of women's health physio, whether you're in the private system or a public system. If I guess they're going to give you the basics, and that will be to lie flat, to do gentle pelvic floor contractions, to do some really gentle abdominal exercises, which will just be, activating TA. If you don't know what that is and your physio just walks and gives you the pamphlet, you have to ask. Not everyone knows what that is, but doing those exercises for those first few 8 weeks is what's still going to help the healing process, and for you to be able to feel like you've got a little bit of connection and strength to your pelvic floor and your abdominal muscles. So you don't want to be pressing hard and doing really, massage movements or anything like that, but you can still be gently touching around the scar. You could be using a brush, like a makeup brush or something like that over the scar.
I was going to say, not a hairbrush, I guess.
No, like a nice
makeup
soft,
brush.
like a makeup, a blush brush or something like that around the area over the scar. Because at the end of the day, you're going to have, for some women, they're going to have numbness around there for quite a while. And that's just helping that those nerves and that nervous system to still have that connection. You might not be able to exactly feel it, but it's still there. So you're still telling your brain, I'm using my hand and I'm using my fingers or this brush, and I am touching this area. And it keeps you connected with what happened there. Most women do not touch their scar in their bellies for a few months after having a cesarean. That when I ask women, most of them don't touch it at all. Why? Maybe they don't feel confident to touch it. They're not sure about the scar. They're not sure about the stitches. But also there's obviously, this is a whole nother topic, but there might be trauma associated with that area of the body, and it just feels easier for them to just not touch it. They don't feel like they want to bring that up yet.
No, that was good. That was needed, especially like the gentle brushing and just reconnecting with your scar, and then noticing if you just don't want to be near it, and there could be other things going on for you.
Yes. Yeah, exactly right.
So talk to me about what actually this release therapy is, because you've obviously done it on yourself, have you, with the second scar and not with the first?
Yeah, so I didn't really do anything on at the end of the day, whatever I'm doing now, like the work that I'm doing on my body and the massage that I'm doing still goes back to how my body healed from my first cesarean. Any scars, any adhesions, that sort of stuff, they don't necessarily disappeared from the first cesarean and then reappeared on the second cesarean. They were potentially always there. Does that sort of make sense? It's sort of my whole, like my body healing from 2 cesareans is my body healing from 2 cesareans. And so I wouldn't say that I personally have trauma associated with that space. I feel really confident in massaging, touching that area, working quite deeply. But my cesareans, though, now were, 8 years ago and nearly 5 years ago now. So a long, long time ago, but I still have noticed a difference even in the last 6 months, because I've actually been doing it a lot more on myself, knowing that I'm seeing a lot more results on women that I am treating as well.
I think that's important to share, that it doesn't have to be your newly postpartum to get any improvement.
Absolutely not. Absolutely not. At the end of the day, someone that's probably newly had a cesarean is probably more likely to see slightly less changes, not really changes, because their body's actually probably not doesn't have years and years or months and months of those adhesions and that scar tissue building up. Whereas someone that had a cesarean 10 years ago and has been having all these weird body dysfunctional things happening. I've been trying this and I've done that, and my hip still hurts and my back still hurts. They're probably got a lot more symptoms, signs, than someone that had a cesarean 3 months ago. But someone that has had a cesarean 3 months ago, and they're starting treatment on themselves or coming in for treatment earlier, will hopefully not have those signs and those problems in 10 years' time.
And have you been able to, with this scar tissue therapy work that we're going to explain so people can actually try it at home, have you seen improvements? Because lots of women talk about that shelf, that belly shelf. Have people been able to see improvement with that?
Yeah, absolutely. I mean, generally you can actually see a difference straight after a treatment, straight away.
Wow.
Yeah. And I mean, to be honest with you, it's generally the number one reason why someone will come and inquire about treatment or coming to one of the workshops or whatever, is that sort of the go-to. It's just, I see it. It's a physical thing that I see in the mirror every day, that I turn my body on the side, I see my shelf. I feel my shelf. I mean,
it's understandable, isn't it? You don't feel confident in yourself. You're like, what is this?
Definitely right. And, it's, women come in all shapes and sizes. And so that shelf looks really different on different body shapes as well. You feel like you just got to find the right thing to hide it. What can I wear today that doesn't show my shelf? And I mean, the shelf itself, like, that's like a whole episode in itself. Like, what is the cesarean shelf?
Yeah.
And I get, at the end of the day, it's straightforward. That's, a band of scar tissue sitting there and I mean, to begin with, we're generally, after birth, we've got a bit more fat on our bellies, right? We still look like we're pregnant. And that scar that's sitting there is so tight. It's like, you've had stitches and pulled tight. So you've got this tight little band that sits, and then you've sort of got your fat from your belly that just sits over the top. And I mean, for some women, you might lose a little bit of that fat and your shelf might disappear after a little bit. As in, it just looks like it disappears, but that scar that sits there will never disappear. So we need to make sure that the tightness that sits on that scar and behind that scar, we want to release that tightness. So if we can release that, it sort of feels flatter. It doesn't feel as tight. It doesn't feel like someone's pulling a drawstring internally. Does that sort of make sense?
Yeah. And that is what the release work is. You're breaking up that scar tissue.
We are. So we're going in and we're using different hands-on techniques. So we'll use our hands. But I know that, I guess, when we talk about a lot of this, we are talking about the scar itself. Yes, we're talking about the adhesions. We're talking about the incision area and around that. But a huge thing, and the first thing we actually look at when you come in, is we look at your breathing and your diaphragm. And we'll actually start releasing your diaphragm, your ribs, your intercostal muscles. We look at this part of the body so that you can breathe and expand and contract your bellies. We actually look at that first, generally. Yeah. We don't just go bang straight into the scar. We'll actually try and we'll assess your breathing pattern first. And for most women, lower abdominal area, there is very, very little rise and fall. And the best way that we can stretch our scar internally, inside those adhesions and that scar tissue, is to breathe. When you 100%. Breathe and you expand your belly and you expand your ribs, you're stretching the scar tissue and you release. If you can't breathe properly, if you've got your shallow breathing happening, you can't stretch that internal scarring. So if we can just release through the diaphragm, get you breathing deeply, a deep breath, probably a breath that you haven't taken in a long time, then we can go into the scar. and we can start looking at those adhesions and touching and moving and manipulating. So for us, the big thing is looking at the diaphragm and getting you taking a few deep breaths first, connect with your body, connect with your breath, then we're going to go into the actual, I guess you could say, work itself.
Okay. And people can even try that at home, because instantly I was breathing deeper when
Yeah,
you were saying breathe. Like,
yeah,
it's a common one, postpartum. Like, whether you've had a C-section or you've had a vaginal delivery, focus on breathing
absolutely.
first.
Yep, exactly right. And I guess also we just, our nervous system is so like,
Yeah, we're in a stress response constantly, so it's going to change the breathing.
absolutely. We also use, in the treatments, we will use other little tools. So a big tool that we use are cups, so myofascial cups. And that's a really, really fantastic way to really bring circulation back into the space as well. Generally with adhesions and scar tissue, they're quite stagnant. There isn't great blood flow to the space. And remember that blood is a really good cleaner. So when we get that into the muscles and we get that into the tissue and the fascia, it can help clean out any debris, bring in lots of good nutrients into the space. So we use those cups to help with circulation. We use those cups to help create space between some of those layers of muscle, fascia, fat, skin, particularly over the shelf area where that scar sits and the shelf sits on top. Placing cups around that space can create more space between the layers and lift that scarring out. Pull it away from internally. Think about the drawstring that pulls you inwards. The cup is basically trying to vacuum outwards.
I never even thought about cupping around. Do you use it on the scar
Yep.
itself as well, or is it always around?
No, all the way around, up, down, around, circle, circle, and directly over the scar. Yeah. Depending on, again, the scar itself, someone that was
Mm.
8 weeks postpartum, quite a new scar, we probably wouldn't be sticking cups directly over it straight away, but definitely around the space, cupping into the diaphragm, great. Over the ribs, great. All
Mm.
around that space, really good. But yeah, a new scar itself, probably we wouldn't directly have it over the top.
And do you do any other techniques
What do you mean?
releasing the scar while they're with you? Like you've said, the cupping.
Yeah, so we do cupping. I'll sometimes use a little gua sha tool, which
Oh,
is,
yeah, I know that for your
you know,
face. It's like the
yeah,
anti-aging stuff, isn't it?
yeah, it was anti-aging for your scar, babe, okay?
Nice. I would
Again,
never have thought to use something like that on a scar, because in my head, I think a scar, or I'm not going to touch it because what if
yeah,
it rips open and that's too hard on
yeah,
it?
yeah. And that's well, if you think that,
Yeah.
other people are going to think that, right? So using tools like that, just if particularly maybe if you are someone that doesn't feel I don't want to touch it. I don't feel like touching it. Then maybe using a tool is a great way for you to gently start working on that space. So using a gua sha tool or something like that. It's not skin to skin, but you could just gently work around the scar and over time over the scar.
That's a great one, because then you're not actually connecting with your hands, so maybe it's easier to go
Yeah.
in. Even you, like you said, using that makeup brush, just a
Yeah.
gentle
Yeah,
get
and
used to.
that using a makeup brush, like using a brush and just rubbing over that space, that's treatment. That's you treating your scar because eventually over time you'll feel okay with that and you'll move on to the next thing. And the next thing might be using a tool that just goes a little bit deeper, and then a cup, and then your hands, then you're physically going to touch skin to skin in that space.
What other at-home techniques could mums use to support healing? Like, you see all these oils everywhere. Is there some like oil that you're meant to be using and not meant to be using to
I mean,
help the scar?
I'm probably not that's not really my forte, but I would say, something that's got, it's a hydrating oil, something that maybe has got some vitamin E in it, which is really nice for skin rejuvenation. You don't want to be putting something on your scar though, particularly if it's a new scar that's like just full of crap. just keep it nice and simple, something that's really natural and organic, and it might feel nice for you if you do have any stretch marks or anything like that, which most women do, right? Maybe getting something that has been recommended for healing those as well. But I mean,
Could you just use olive oil and coconut oil? Is that
absolutely. Yeah, yeah.
okay?
Yeah, we normally use coconut oil in our clinic. Using probably like a balm is sometimes has a little bit more like friction on it. Sometimes an oil can be like too slippery. A balm tends to just, yeah, it's hard to explain, but it's got a little bit more thickness on it.
Yeah, it
So
makes
if you're
sense. It would
using,
slide.
yeah, so if you're using your fingers, like if you are using your hands and your fingers, a balm sometimes give you a little bit more resistance to work with. But look, at the end of the day, it's not like if you're not trying to rip your scar apart, it's like anything that you do in that space is going to be really helpful. Even if you feel like I don't know what to do. I don't know how to do it. Just put your fingers on your scar, press down gently and do little circles. That's all you got to do. Push and circle and do
So
that
it's not a deep push, it's literally just a touch
however
to start with.
however feels comfortable for you. That's the thing.
Okay.
Like if
Okay. So could you do damage if you're going too hard?
if you're going too hard too early, yeah, I guess so. If your body isn't healed, if that scar on the outside, if those stitches are not healed properly, then, um, and you're going in there with oil and you're poking around too much, then you're potentially going to cause infection there. So you don't want to be touching that area or putting anything on that space until it's fully healed. But if you were pushing so hard to cause damage, that would have to feel extremely, extremely, extremely uncomfortable and painful. I would never work on somebody that was feeling that pain. There might be some particular areas that feel a little uncomfortable, and I would work with somebody. How does this feel? How does this feel? Back off, give them a little bit more. After a while, in a treatment, generally, within 20 minutes, you're going to get release and you will be able to work deeper than what I could 20 minutes ago.
So slight discomfort, especially if you've got an old scar, is
It's
okay.
okay. As long as you're not gritting your teeth doing the movement. That's not the point.
Then
That's
you
not the
know
point.
there's something not right.
We don't want you to be practicing these things in pain, right? It's not about being totally uncomfortable and in excruciating pain while you're doing it. That isn't the point, because potentially you're already feeling pain. I don't want you to
Mm.
feel pain again. I want you to feel comfortable. So it may be that light touch is your first, is your first point of touch, and you build from that.
And I guess it's taking the time to be okay touching that scar, being and then rethinking about the birth as well. It's like reconnecting with yourself and being kind to
Exactly right.
yourself, and it's a whole process.
Absolutely. It's time, it's conscious time that you're spending this, on you and thinking about doing this. I mean, for some women, it might be that they're actually doing this in the shower. Or I do feel like when you're first beginning, though, it is really nice for you to lie down, take the breaths, think about it. So really feel what you're feeling. And then over time, when you become more confident and you become more comfortable doing it, then doing a few stretches, doing some strokes, that sort of stuff in the shower is really great. But if you can still bring yourself back every now and then, lie down, breathe, close your eyes, put your hand on your belly and feel that space, I think that's still really important.
It's definitely a healing, sort of nurturing thing to do, isn't it, for
Yeah,
yourself?
yeah, absolutely right.
I want to leave with this one question. What's the one thing you wish more women knew about C-section scars and recovery?
I think the most important thing is that, postpartum is forever, right? Our
Hmm.
the experience that we had and the surgery that we had, we can't take that back. It's always there, it always happened. But you can change how you feel about that, and whether that is an emotional thing for you or a physical thing. And I guess when it comes to myself, I'm more trying to help women to be able to change it physically. Um, and there are other, professionals and practitioners out there that can help you on a real emotional level. But I guess I wish people or women knew that you can help yourself, even if you feel like you're in it on your own. You're not. 39% of women birthing are having cesareans. That's a lot of women. You're not alone. I think that's the biggest thing to remember, and that we're having so many more conversations now, which is great. It's so good.
Be okay with asking questions. It's your
Yeah.
body. You
Yeah.
deserve to know whatever's come up in your mind. And if they don't give you an answer, or if they just brush you off, then go and ask someone else.
Yeah, absolutely. And also remember, if there's 10 women in your group of friends, I mean, it's not always, or 10 women in your mum's group, 4 of those women had cesareans.
That's the question you asked me, wasn't it? Because
Oh,
I've
yeah,
got a
that's
group, my
right.
Saturday
Yeah.
classes, then I've got, what, 15, 16. I was like, how many? Because you put a bet on how many
Yeah.
of you had C-sections.
Yeah.
You were
And
right.
so, it just ask one of those women, like, how do you feel? Does your belly hurt? Does your scar hurt? Do you have a shelf that's over your scar? You don't have to ask them in front of everybody, but, ask them, how do they feel? Oh, well, I feel great because I went and had a cesarean scar treatment. Or, it just starts that conversation with, oh, yeah, I wonder what we could do. Yeah, I'm feeling like
Definitely.
that too.
Yeah. Spread the word.
Yeah,
Mum's community goes
it's
for
not
wildfire.
absolutely does. And just remember that now there are more women out there, and it's only increasing. It's only increasing at the moment. So, yeah, I guess there's more women that are experiencing what you have experienced.
You are not alone.
Yeah,
Thank you, Nikki. As
great.
always, I hope you enjoyed yourself.
Oh
I
God,
know.
we could talk for another hour, couldn't we?
I
Really?
know,
Oh my God.
exactly. Always come out with
I'm sure
new
that happens.
ideas.
Yeah, I'm sure that happens all the time with you.
I'm like, cool, I could do another 3 podcasts.
Yeah,
Right.
yeah. Oh God. I just want to, I just want to show you this picture that I do have. And this is I don't know if you can see it, but you know how I told you I'm a very visual person, but
Mm-hmm.
this is a picture that's in the little booklet that I give out in our workshop. So this is a picture of, can you see that? Oh, where am I
Your
pointing?
video's not showing.
Can you see?
No.
No, gone.
Yeah.
Yeah, that's weird. Well, anyway, I'll send it to you and I'll show you this picture. When you look at this picture, and you can see it's a picture of scar tissue. There are 2 separate bits of body connected to each other. That
Wow.
is the scar tissue. When you look at it, you think, yeah, hell yeah, that's why I've got pain. That's why my hip
Yeah.
hurts. Bit of me is connected to my hip that shouldn't be connected.
It's
Or
crazy.
my bladder is connected to my uterus. It shouldn't be connected to it.
Is there a way people can see that as well? Is it a link we can share in a Google Drive?
No, not really, but maybe. I'm sure
I
I
wonder,
can work out a way.
we could look at something up,
Yeah,
like a link of how
yeah,
one, just for people to look for themselves.
yeah.
Well, thank you again for
Hey,
joining us.
no worries. It was absolutely my pleasure,
Goodo. We'll say bye for now, everyone.